All right, be careful. Chew it up. Chew it up. Is that good?
Yes, sir.
Got that right. You got it. Careful on small bite. Silly boy. You're a goober. Chew it up good.
So totally different styles as we see and probably different needs. For the first video, she mentions small bites and reminds him to chew frequently. Do you have any other suggestions around the safety of eating whole foods? Meaning like not chopped up and processed. Yeah. Sorry, Dr.
Yeah.
Frank.
Yeah, no, I have a great team, and I really do rely on my speech and language pathologist and dietitian as part of the team to weigh in heavily when it comes to this. And normally I would say cut food up into small bites and use small utensils. At the same time, this video demonstrates that we're really trying to preserve this person's autonomy so that they can feed themselves. And finger foods is a great way to do that. Finger foods can still be cut up small, but obviously the smaller it is, the harder it is with someone who doesn't have normal control over their fingers to get it to their mouth. But small bites and something to create a pause in between, whether that is putting the utensil down, taking a sip of water. I think that those are important strategies, but small bites, whether it's put in front of them as small bites or being a broken record and saying it again and again, small bites is really important. The other thing that many people with Huntington's disease do, even with small bites, is something that I've termed chipmunking, where they will put a bite of food in their mouth, and before they can chew and swallow, they'll put another bite of food in their mouth. And before they can chew and swallow again, and sure, before they know it, their cheeks are full and they don't know what to do with that. And even though there were small bites, they try and take liquid and try and force that down. And that's where choking can definitely happen. And that's an impulsiveness as well as lack of judgment when it comes to eating. And I really haven't seen it in other neurologic diseases. So it's something that is relatively uncommon outside of HD. I think certain foods are easier to chew and swallow and to cut up. Those look like fish sticks, which is nice and soft, versus overcooked dry chicken, which is going to be a lot harder to chew and swallow and give more trouble. So I think the type of food that you put in front of the person is also important in terms of getting them to take small bites.
In this video, and it was interesting, I thought it was chicken nuggets, so who knows if it's chicken nuggets or fish sticks.
Whatever, it fell apart easily. So
it did fall apart easily, and I think he ate slowly. So for a lot of people, it looked like to me a tremendous amount of food was there in front of him, but he wasn't shoveling it in, and she was reminding him. So I think it was good. For some people, I do say to the families, put smaller portions out, because exactly what Sam said, it's what I say to people when you get a puppy, and if you put a ton of food out, the puppy will just keep eating until there's no food, not until they're not hungry anymore. So I do have a lot of people when they're eating, especially at a restaurant, because at least in America, we are given tremendous amount of food on our plate, and people will keep eating until there's nothing left. And there's a lot of times that they're vomiting. So that can happen. I didn't see that, at least in this video, and it was quite short, that there was a chance to take sips of a liquid in between. And that will give people a time to try not to chipmunk or to get that dry, crumbly feeling in their mouth of chewing something. So that could have been something, but it looked like there was a good relationship, and it wasn't that she was nagging, but she was just saying, chew it up and then take another piece. Oh, make sure it's a small piece. And she was ready in case there was a problem there. So I think that was really good. It might also be ketchups and mayonnaise and sauces and gravies. We tell people a lot of times, if you love something, put a lot of sauces and gravies on it, because that will mush it up a little bit. And sometimes it's a little easier to chew and to swallow. So those are some ideas as well.
Fantastic. And so we'll go into the second video, but I'm going to just plug our cookbook. And one thing, the Help for HD cookbook, look.
I was ready. I was ready.
That's awesome. And the cookbook is one of those that like when we were preparing these recipes, when we asked professionals and family members, the one thing that came across was that they really wanted to foster the traditions and the love that happened around the kitchen table. And it wasn't even about food. And we went, wow, it turned in a different direction. So what Sam said is giving him the independence to still eat on his own. That's huge. Like Heather, like bravo for you have, and like Heather was right there. She's ready, but man, that when that's taken away, it's driving eating. They already lose enough through their journey, and to eat on their own is just, it's just heartbreaking. But anyways, that was just a comment, and thank you for having that plug with me, Dr. Hennig. Okay, video 6. When is it time to go from whole foods to chopped, small, and then pureed?
Again, I think that this is where working with a good speech and language pathologist is important. I think a lot of people will see that if someone is coughing when they're eating, that maybe that we should change things. Coughing is a normal, natural human response, and it's actually dangerous when it's not there. And when people lose their gag, when they lose their cough response, they're at higher risk of aspirating. And so having a speech and language pathologist who knows about HD and the coordination problem in the mouth, as well as what can happen to get food from between lips and stomach and make sure it gets there safely, is really important. I've worked with multiple speech and language pathologists. Some like to do what's called a FEES. And basically you take a teeny tiny camera, put it into the nose after you numb it, and then look at how things move in the back of the throat past the vocal cords. But you miss everything that happens with the lips, the tongue, the soft palate. And so having a barium swallow or a video swallow to see what happens with different foods of different consistencies after it goes into the mouth and goes down has been really very helpful. So I think working with an experienced speech and language pathologist, getting the right test and knowing what's a good reflex and what's not in terms of safety around eating will help to decide what's the right consistency for people.
And Dr. Frank, if people, we know that swallowing and aspiration is a big deal in HD. Does some of the swallowing, we're talking about pocketing food and the chipmunk thing, but does some of it have to do with chorea? Is it involuntary, like for them to not, would something like a treatment and looking at that would help swallowing or something along those lines?
Yeah, and there's 2 components to that. One is the actual chorea of the mouth and tongue, and that if that is suppressed, people theoretically can have better, more coordinated movements to move food around in their mouth to get it right. But the other component that I think is probably more important from a choking perspective is trunk chorea. When people have trunk chorea and they inspire and food's in the mouth, they're at higher risk of choking on that. And that has nothing to do with what's going on in the mouth. So I think those are the 2 main choreiform movements that I look for that we may be more aggressive about treating if there's recurrent pneumonias or aspiration.
So do you have any suggestions, any of you, for making food does not look appetizing? So do you guys have any ideas?
So I learned from Jim Pollard on this one, and I'll never forget this conversation I had with him, because he said exactly the same thing. And they worked with a chef at a chronic care facility to use fresh spices if possible, right? Because that adds nice, bright, natural color to the food. Making sure that cold foods are cold, that hot foods are hot, not too hot, but the right temperature really matters, right? And spices, I think that we often forget, there's a huge aisle in the grocery store that's filled with spices that pose no choking risk, that can change the flavor of food, can change the color, can really make it an interesting food. And you can also, depending on the consistency of the food, and this is where I remember Jim talking to me about chicken, they would take chicken and chop it up and then reform it into what looked like a drumstick. So it had the visual appearance of chicken, even though it was chopped up chicken. And so you eat with your eyes first, you smell the food before it even crosses your lips. There's a lot that you can do on those aspects to help make food at different consistencies more appealing.
And if you put it on a plate, and I was like, if you think about going to a fancy restaurant, you get something called duck confit. It is reconstructed, right? So you can make things look nicer. It doesn't have to just be on a plate. It can be in a little mold. It can be with the sauces on top of it. So even the second video where she was chopping up things, it didn't look awful. It was, especially if it was going to be placed in a mold, you can put a mold of different shapes. There's lots of things that I think that people can do. And I think it's important to remember, you're not going from a steak dinner to a tube feed. There are so many, if a person chooses that. But I think that it's really important to know that there are lots of things that you can do in the meantime. And it might not be what somebody might feel comfortable in terms of what they consider finger food, but really knowing that there is a way to keep autonomy with people to say, I want to be able to feed myself. So I think that's really important. And just, I'm not sure if we're talking about it, but other things, not just about making it appeasing to your eyes, but also just little things in terms of using a straw. Exactly what Dr. Frank was talking about, that when we have people who are drinking and throwing their head back and they have this chorea, that even on liquids you can aspirate. So I think a chin tuck, which our speech pathologists and sometimes nutritionists will teach people, is just keeping that head down a little bit, just keeping the chin down a little bit to open up that whole area, and using a straw can be really, for people who can negotiate that, because when you do have that mouth and tongue chorea, it might be difficult, but for people who can, using a straw can be really helpful as well.
And I'm just going to put it out there. Sometimes those like children's cooking TikToks, like where like they're literally trying to hide vegetables in foods and chopping things up. And it could be a whole vegetable like meatball or something like that. There's a lot of different creative ways of being able to combine different things and add tastes and add proteins, and so utilizing social media too. So with everything that's been said, but also there's some really creative ways that you can look at, how can I make this a little bit more appetizing by some of these reels and some of these things that people are doing for children or for adults who have more of a soft food diet.
And this question you guys already covered on, but is it important to drink fluids between bites, with bites, or completely separate with the food intake?
I would
Yeah.
I think, yeah, definitely with bites. And remember, thicker liquids are going to be a little bit easier. So that sometimes confuses people. I don't think there's too many people. I'm not a coffee drinker, but I know that from people, they don't want to put a thicket in their coffee because it feels like sludge. But I think it is important to know that thicker, colder drinks like milkshakes or something like that can be easier to get down. So just trying different things, but definitely having things moister, I think is going to be better in terms of the choking. We can't prevent it 100% because people can unfortunately choke on saliva. So I think it's really important to know that it's not 100%, but if we do things to keep people safer and more independent, I think that's going to give them a better quality of life.
And in addition to fluids helping food get down, it's a good time to keep people hydrated, because there may not be other opportunities to get them to drink water. And that's important for general health, for bowel health, for blood pressure, lots of other reasons too.
Thank you. And she also, at the end of the video, she mentions having a life hack on hand to assist with choking occurs. Are there other devices that you know of that work better, or do you guys think the life hack is a good option?
I think any family who has Huntington's disease should learn the Heimlich maneuver. So really making sure that you do talk to your healthcare practitioners and say, how do I do this correctly? Or your local American Red Cross or something like that, I think is really helpful.
And I've heard mixed reviews about LifeVac, because exactly what you just said, Bonnie, about learning it properly. If you don't use the LifeVac properly, it actually can make things worse. And so to know how to use it properly, I think maybe a useful tool to have in the house that's not expensive. What we do in our clinic, we usually work with our patients' insurers to have a home vacuum device, an oral vacuum at home. And those can be rented for not a lot of money and can provide a level of safety. And as long as we're on this topic, I also want to emphasize that seeing a dentist and making sure dental care is kept up to date, because that is a huge aspect of, if people do aspirate, having a less malignant bolus of food get into the lungs and can provide more comfort, and people can chew better if their teeth are in better shape too. So don't ignore dental health when it comes to Huntington's disease.